Hey, Dr. Amy here, and in this video, I'm busting 5 common breast cancer myths. It's time for you to know the truth. These 5 myths are so common that even some of the most brilliant breast cancer survivors fall for them. I do not want you to make the same mistake. So many women fall victim to this. These myths can cause so much unnecessary stress and anxiety. As a cancer survivor, you do not need any more stress. Let's put an end to this once and for all so that you can feel safe in your body once again. The last myth I cover here, well, this one is gonna surprise you. But first, myth number 1, underwire bras cause breast cancer. There's long been a theory that underwire bras cause breast cancer. The theory is that underwire bras actually stop lymphatic flow, so harmful cells kind of get backed up and stay in the breast area. This results in breast cancer. Lots of people online will tell you to not wear a bra to bed or do not wear an underwire bra ever. But is this true? In 2014, a study was released looking at breast cancer in association with wearing a bra. Basically, they were looking to see if women had a higher risk of cancer if they wore bras. They also looked at the number of hours in a day each woman wore their bra. If you wore your bra at night or for a longer period of time, were you more likely to have breast cancer? Plus, they looked at the age in which each woman started wearing a bra. If you wore a bra for more years of your life, were you more likely to have breast cancer? They also looked at the type of bra you wore. Were you more likely to have breast cancer if you wore an underwire versus a bralette versus a sports bra? This is an interesting study because women have been wearing bras for a very long time. So we have lots of data and exposure to truthfully answer this question. Well, here's what they found. There is no association between wearing a bra and breast cancer. Even if you wore an underwire bra 24 hours a day, there is still no increased risk of breast cancer. The worst case scenario to wearing an underwire bra 24 hours a day is just being really uncomfortable, but it's not gonna give you breast cancer. So, myth busted. On to myth number 2. If you're diagnosed with breast cancer, you must get your breasts removed. There's a common thought that if you're diagnosed with breast cancer, then you have to get a mastectomy. But the first thing that you need to know is that you are in control no matter what. You do not have to do anything with your body that you do not want to do. Now, with that said, knowing that the choice is ultimately up to you, we do know that about 25% of women diagnosed with breast cancer will be clinically advised to have a mastectomy. A mastectomy is what's gonna get these women the best treatment outcomes, the highest chance of no recurrence, and the highest chance of survival. But actually, far more than 25% of women diagnosed with breast cancer end up getting a mastectomy. Many women want to do as much as possible to minimize their risk of a breast cancer recurrence, so they opt for a mastectomy. We know that actually up to 75% of women diagnosed with breast cancer choose to get a mastectomy. Many breast cancer survivors that I work with in the Cancer Freedom Program actually choose to have a double mastectomy. Even though it's not necessarily clinically necessary, they opt in that direction. They want to do everything to minimize their risk of breast cancer recurrence. So they opt for a double mastectomy now in hopes that they will not have to endure treatment in the future. Whatever you choose as a breast cancer survivor, your choice is valid. Your body is yours. You get the ultimate choice. But this myth is busted because not every woman who's diagnosed with breast cancer needs to have a mastectomy. On to myth number 3. If you don't have a family history of cancer, then you're unlikely to be diagnosed with cancer. Okay, this myth is a bit ridiculous. Like, come on. This is clearly not true. Let me show you what I mean. We know that up to about 10% of cancers are due to some sort of inherited genetic mutation. This is something like the BRCA1 or BRCA2 gene, but 10%, that's pretty small. But wait, there's more. We also know that about 20% of cancers occur in someone that has a family history of cancer. Now, there are many families who many members are diagnosed with cancer at a young age, and they're diagnosed throughout their generations. But in some of these families, we find that they do not have any genetic variants that could increase their risk of cancer. Everyone is negative. It just goes to show that there's some genetic component to their cancer diagnosis. We just don't have the answer yet. It just goes to show that there's some genetic component to their cancer diagnosis, but we just don't know what that gene is yet. It makes sense, right? There's still a lot we have to learn about cancer. But 20%, that's not very high either. That means in reality, most people are diagnosed with cancer without any family history at all. That was my exact situation as a cancer survivor myself. I have many sisters, both older and younger than me, and no history of cancer. My mom, my aunties have never had cancer. Both of my grandmothers did, but they were both diagnosed in their 70s and 80s, so really no family risk there. But still, I was diagnosed with cancer. It's very unlikely that there's some genetic component in my case, but still, I was diagnosed with cancer. So that myth is busted. Next up is myth number 4, soy fuels hormone-positive breast cancer. Soy is often referred to as a phytoestrogen. It has a similar chemical structure, but not the same, to the estrogen that's circulating in our body. Similar, but not the same. The theory in the past is that if you ate soy, it would increase your hormone levels. Because it's acting similarly to the estrogen in your body, if you ate it, it would increase your hormone levels and fuel your hormone-positive breast cancer. Some people even go as far to tell perfectly healthy women, no history of cancer at all, that they should avoid soy because it may increase their risk of hormone-positive cancer. But for cancer survivors, it was thought that if you ate more soy, you would increase your risk of a cancer recurrence, especially in ER-positive breast cancer. The phytoestrogen properties of soy would cause your cancer to grow. This theory actually resulted in many clinicians around the world telling breast cancer survivors to not eat soy. Don't eat it ever again. But here is what you absolutely need to know about soy and breast cancer risk. Over the last several years, there has been an abundance of scientific literature completely disproving this. The most impressive was in JAMA in 2009. This study looked at 5,000 breast cancer survivors and followed them for about 4 years. They found that eating soy significantly reduced the risk of breast cancer recurrence and death. So eating soy after breast cancer actually meant you lived longer. You were less likely to have a breast cancer recurrence. So let's back up here. We've gone from soy is dangerous, never eat it again, to soy actually lowers your risk of breast cancer recurrence and death. Eating soy can actually help prevent your breast cancer from coming back. Yes, it's true. The scientific literature has proven this over and over again. They summarized 12 scientific studies that looked at soy and cancer risk, and again, found if you ate more soy, you actually lowered your risk. Okay, so you should be starting to feel a little safer about eating soy. But if you have hormone-positive breast cancer, you might be thinking, well, what about me? Is soy safe in hormone-positive cancer? We also know that the impact of eating soy on our body is dependent on the tumor type. So eating soy will have different effects if you're hormone-positive, hormone-negative, HER2-positive, HER2-negative. But the most benefit from eating soy can actually be found in hormone-positive breast cancer. If you have ER-positive breast cancer, then not only is soy safe for you to eat, but it could actually reduce your risk of a breast cancer recurrence. This is such a tough one to digest. So many breast cancer survivors are told that they should avoid soy after they've been diagnosed with cancer. This is outdated advice that is not based on any good literature. Even the oncologists that work in my local area, they still tell cancer survivors to not eat soy. It's based on nothing at all. I wrote letters and sent them studies asking them to stop. Putting dietary restrictions on breast cancer survivors has a negative impact on your life. You learn to be fearful of food, and for many cancer survivors, it actually leads to disordered eating. Even if you've previously never had an eating disorder, this food fear around cancer can lead to eating disorders after a diagnosis. So myth busted. Soy is safe to eat in hormone-positive breast cancer. Okay, but that takes us to our last myth, and this is a good one. Myth number 5, deodorant causes cancer. This stubborn myth has been around for a very long time, and it's time to squash it. Here's why. For many years, there has been a myth that deodorant causes breast cancer. Some say that deodorant actually blocks your body from sweating, so it prevents you from getting rid of toxins. They build up in your armpit and cause cancer. This is why so many women get diagnosed in their lymph nodes up towards their armpits. There's another theory that parabens or aluminum in deodorant causes cancer. This theory really stems from a study that was conducted in petri dishes that showed high doses of parabens actually increase the risk of cancer. The doses they used in the petri dish studies were extremely high doses, much higher than what you would be exposed to through deodorant. Regardless, let's look at what these researchers found. Does deodorant increase your risk of breast cancer? There are now a few studies that look at this specific topic. Researchers looked at the relationship between deodorant use and breast cancer. They found that there was no association between deodorant and breast cancer risk. There's also no increased risk if you apply deodorant right after shaving. Based on this literature we have, deodorant does not increase your risk of breast cancer. But honestly, busting these 5 myths is just the start. There are clear and strategic ways that are backed by scientific evidence that you can lower your risk of breast cancer. I would not recommend throwing out your deodorant, your Underwire bras, or avoiding soy, but I would recommend doing this. I've linked up this next video here. This is how you can make a real impact in lowering your risk of cancer. I'll see you in the next video.